Hearts Around the World is the theme for the 2003 Florence Heart Ball. We'll take you behind the scenes coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at BB&T. We're focused on the 2003 Florence Heart Ball to be held on February 15th at the Country Club of South Carolina. And we're visiting with Dr. Ian Smith, the chairman of this year's Heart Ball and a cardiologist with Advanced Cardiology. Dr. Smith, thanks so much for being with us this morning.
Thank you for having me.
Incredible opportunity to highlight this year's Heart Ball. All week we'll be visiting with guests that have either dedicated themselves as volunteers, as sponsors, or active associates working with the American Heart Association. Couldn't think of anyone better to kick off the week than the chairman himself. Thanks so much for helping to fight heart disease and strokes. Can we talk real quick about yourself? Are you originally from the area?
My family moved here in 1970. My father was the founding president of Francis Marion College, and so I've had some connection with Florence since 1970. I moved back here after practicing in the Northeast for a number of years, about 5 years ago, primarily to be closer to my family, and it's been a wonderful experience coming home.
And you have a lot of family here in the area.
I do. My brother lives in Columbia. My wife's brothers live in Aiken, South Carolina. As Truman Capote said, one way or the other, all Southerners come home. So I'm home.
Very definitely. Did your dad's position at Francis Marion have any, obviously the commitment to be back close to family, was he still involved with Francis Marion when you came back?
Only from a distance. I think any ex-president can't completely keep his hands out, but he's loved that college, and it's been, I think he's always wanted to stay close to his baby, so to speak. So he's remained here even though he retired some years ago. And, of course, he remains quite active in community affairs.
Sure. We taped out there in September, a week focused on some events going on, the PD International Festival, the Heart Walk.
Yes.
We did a couple days focused on the Northeastern Strategic Alliance and had Dr. Carter in. It was amazing. Actually, we taped in the President's Boardroom. Had Ed Young in, a focus on Ed Young, which was spectacular. So I can see the feelings that he would have towards a facility and an institution like that, and having grown it must be amazing. What about your involvement with the Heart Association that would have prompted you to take on this position as chairman? That's a heck of a lot of work.
Well, I'm a cardiologist, so this is part of my trade, so to speak. I've been involved one way or the other with the Heart Association for a number of years, although this is the first time I've been this involved by doing the Heart Ball. But the work of the American Heart Association is very important to my job, but it's really important to the people in the PD. Because, as you know, heart disease is an enormous problem in this area, more so perhaps than in other areas of the country. And when I moved back here, with that in mind, I thought I really should do more for the people of the community outside of my office practice.
Where did you begin your medical training, Dr. Smith?
At the Medical University of South Carolina. I was living here at the time. I enrolled there. After I completed my training there, I moved to New York, did my internship and residency in New York, and then came back to Duke University for my cardiology fellowship.
Great place.
I enjoyed it tremendously, and I still stay in touch with a lot of the Duke people, and that's been a nice resource. So I feel particularly lucky because I've got connections both at Duke and at the Medical University of South Carolina, so I can really stay in touch with what's going on in medicine.
My father had a mini heart attack and was taken very good care of by the folks at Duke. We're very blessed to have that close at hand. How about any particular reason why you think you selected cardiology as your specialty, or what you would commit much of your life to?
Honestly, these decisions are made for perhaps irrational reasons as much as rational reasons. But there is a whole lot more to the heart than simply a pump. And while this is probably not terribly interesting to anyone watching this show, the heart, for example, is an endocrine organ. We know it's a gland in addition to a muscular pump. And there are many such facets to heart disease that continue to fascinate me and apparently a lot of other doctors. There are quite a few cardiologists around.
Oh, yeah, and a lot of that, I guess, would deal with some of the problems associated with cardiovascular disease in the PD and throughout South Carolina. And strokes.
Yeah.
Do you also deal with patients who have had a stroke or dealt with strokes?
Quite a bit, because the two diseases, heart disease and stroke, are both manifestations of one underlying problem, that problem being vascular disease or blood vessel disease. Florence County, as you probably know, is the capital of strokes. It's the stroke capital. And Florence County, I think, has the highest incidence of heart attacks in the United States. There are a lot of factors that conspire to do this, but this is a center for cardiovascular or blood vessel and heart disease. Every year, probably 1 million people or more have a heart attack in the United States. Another 500,000 to 700,000 people are diagnosed as having heart failure, and there are other heart conditions, making heart disease by far and away the number one killer. And that's true nationwide, and it is particularly true right here.
Do we know why? Do we know why, for instance, in the PD, heart disease, cardiovascular disease is the number one killer? More than 40% of deaths in this county and throughout the PD are caused by cardiovascular disease. Why, Dr. Smith?
I don't know that we understand why the PD in particular has such a high incidence of these diseases. But, you know, although we're high, there aren't places in the United States that are low. It's all high. Throughout the country, heart disease in any state you pick is the number one killer of men and women. Heart disease kills more men than everything else put together. And so when you're talking about us being high, yes, it's true we are a few percentage points higher, but the United States as a whole has a very high incidence of cardiovascular disease.
I don't know why everyone wouldn't want to be involved in volunteering for the American Heart Association. When you think about it like that, when you think if either you or a family member hadn't yet been touched by heart disease or strokes, there's a point where it'll happen. Somebody within your family will have some incident of heart disease or stroke, and that's a really big deal. What can we as individuals or as a community writ large do about the prevalence of heart disease and strokes here in the area?
The first point I'd like to make is that heart disease is a preventable disease. Now, this is a bit of a tragedy if you think about it. It's the number one killer, yet it's a preventable disease. There are some diseases for which we have no prevention. For example, pancreatic cancer. We can't do much about that. But heart disease can be prevented. Largely, this can be done today with current technology through lifestyle changes. And we are still struggling to get that message out. There is much that has been done to take care of the heart attack victim. The chance that someone suffering a heart attack will die from that heart attack is about half now what it was in my parents' generation. We've cut that risk in half. But the real benefit is to be had at the other end of the disease, not at the terminal point, which is death from heart attack, but at the initiating points. We now know, and we're learning more and more every day about how to prevent heart disease, and that's where the American Heart Association comes into play, because we need to get the message out to the people, particularly the people here in the PD. You mentioned a moment ago, you don't understand why everybody wouldn't want to be involved in this. Let me share with you the economic impact of heart disease. The economic impact is greater than $80 billion per year. And much of the brunt of that is taken by employers. Now, we have here a vehicle by which employers can work to improve the health of their own employees. And the benefit of that is going to come back to the employer, too. Lower rate of absenteeism at work. These employers can help us sponsor this Heartball. We're still looking actively for corporate sponsors. And if anyone out there is interested, call the American Heart Association. We'd be very happy to enroll some more corporate sponsors. The American Heart Association raises a great deal of money. That money is spent in research in heart disease and also in public education. It's also spent in educating physicians. And we get back in the PD, because we have such a high incidence of heart disease, we get back more than we put into the pot, so to speak. For every dollar donated here, more than $1 comes back to us right here. So by helping the American Heart Association, employers would be helping themselves.
You said we get the PD gets back more than every dollar that's donated here.
Absolutely.
Because there's such a high prevalence.
We're where the problem is.
Right.
And so we're the focus of the attention of groups like the American Heart Association. So we really do benefit tremendously from this.
And a lot of the funds that are raised through events like the Heart Ball, which you're chairing, or the Heart Walk, I think more than $250,000 was raised this year for the PD area Heart Walk. So much has been done, recognizing, getting out there, trying to change lifestyles, recognizing some of the problems that are inherent in the PD. Those funds that are raised are spent to a great degree within South Carolina.
Absolutely. Yeah, this is a case where we can really help ourselves directly.
Had you worked on previous events, Dr. Smith?
I was involved with the Heart Ball 2 years ago. I was head of the auction committee, and that's how I cut my teeth on the Heart Ball, so to speak.
How many folks have you enlisted to support you in volunteering in this year's Heart Ball?
At this time, we have dozens of people. The community has really stepped forward selflessly to volunteer labor. And, oh, gosh, we've had so many wonderful people who head up various committees. I don't even know the number. We're in the dozens already.
We've just got a couple of minutes, and I wanted to see if you could help share with the viewers your perception of some of the future of helping to fight cardiovascular disease and strokes, not only in the PD, but throughout South Carolina, throughout the nation. Some of your views on how we as a community can, I know we talked about this earlier, but just drive it at home again as we end the interview, some of the ways that you help, that you perceive the future of fighting cardiovascular disease and stroke.
Well, let me start with what we can do right now, because this is something that people, the viewers, can do immediately. One, manage blood pressure aggressively. Don't smoke. Exercise. The New England Journal of Medicine published a couple of articles a few months ago on exercise. Walking 2 miles a day at a modest rate of 3 miles per hour cuts the risk of heart disease in half. That's an enormous benefit. Managing diabetes, that sort of thing. The future is going to be even more exciting because we are now looking into the molecular and genetic bases of heart disease, and soon we're going to see what I call designer drugs that are tailor-made to block certain harmful events from occurring in the body. And so we may have even better technology 2-3 years hence.
It's wonderful. We're visiting with Dr. Ian Smith, the chairman for this year's 2003 Florence Heart Ball. Country Club of South Carolina, February 15th. For tickets or for sponsorship opportunities, you can contact the Heart Association's office at 843-665-0985. Thank you, Dr. Smith, for all your volunteer efforts this year.
Enjoyed it.
Stay tuned to more Carolina People coming up next. Good morning. Welcome back to Carolina People. This morning we're at BB&T, focused on the 2003 Florence Heart Ball. And we're visiting with Jim O'Laughlin, the CEO of Carolina's Hospital System, the presenting sponsor for the 2003 Florence Heart Ball. Good morning, Jim.
Oh, good. Thank you.
Thanks so much for being with us this morning.
It's a pleasure to be here.
Opportunity all week to highlight an amazing event coming up on February 15th at the Country Club of South Carolina, and couldn't think of anyone better than the presenting sponsor and someone just coming back to South Carolina. Welcome to the PD, and obviously welcoming you back to South Carolina. Big opportunity.
Well, thank you. It's a pleasure to be here. It's a pleasure to be back in South Carolina.
I'm sure. The Palmetto State. Can we talk real quick about yourself? Were you originally from the area?
No, actually I grew up in Massachusetts and spent through my college years there, but had an opportunity to do some graduate work in South Carolina at the University of South Carolina. And now I'm back, so I'm very pleased to be back in the state.
Had you ever traveled over to the Florence area, to the PD at all, or maybe travel through the PD, heading somewhere else when you were in school in Columbia?
It was my first time. As a student, you tend to stay on the campus, and really had spent most of my time in Columbia. Mm-hmm. So this is my first exposure to Florence, but it's a beautiful area, and the coast is only an hour away. Just a gorgeous part of the country.
It is. It truly is. When did you assume your responsibilities as CEO of Carolinas Hospital System?
Just actually a short while ago. I began Carolinas in mid-December. And so I've been there for about 6 weeks now.
Golly.
Yeah, so it's been kind of a short duration.
How about where you'd been prior to arriving here in Florence?
Prior to being in Florence, I was a CEO for 2 hospitals in Alabama, in Gadsden, Alabama, and in Jacksonville. And before that, I was a CEO in Oklahoma. So I've kind of traveled a little bit with the company.
Mm-hmm. And family traveled with you?
Yes, my wife and 2 children are here, and they're doing well, situated in the schools, and enjoying the community as well.
Mm-hmm. I'm sure the community's very excited to have you all here.
Well, we feel very fortunate to be here.
Very definitely. And Carolinas Hospital System has had such a dramatic expansion over in the recent past. It's amazing to think.
Well, it's a beautiful facility. I feel very fortunate. We have just wonderful medical staff that practice at the hospital. We have great employees and just all the right ingredients. So I feel very fortunate to be part of such a great hospital.
Sure. How long have you worked in the field of hospital administration?
About 25 years now, so quite a while.
25 years. Yeah. That's amazing. When you think that amount of time and being focused in one area. How does someone go about getting into hospital administration? Is there a track that if a viewer was interested, let's say there's a high school student now watching the show and they were interested in getting into hospital administration, is there a normal avenue they'd approach?
There is. There's not one particular avenue. Now, my course was a little bit different. I came from the clinical side. Mm-hmm. But most people that want to get into hospital administration will go to college and earn a degree in business or business administration, and then usually graduate school beyond that, either a master's degree in business administration or healthcare administration, and then working in a hospital, usually as department director, then working your way up. And you have to certainly be interested in taking care of people, because even though as an administrator you may be responsible for some of the business aspects, we still have a lot of responsibility to ensure we're providing quality, we're providing a good environment for our physicians to practice medicine. So you do need to have an interest in working with people and wanting to take that on as part of your life.
Mm-hmm. Can we talk real quick about your responsibilities as CEO of Carolinas Hospital System? About a month ago, we did an exit interview or retirement interview with Bruce Berrigan. Did a full morning focused on Bruce and his years at McLeod and some of the opportunities of how the community has changed during his tenure at McLeod. And as I thought about him talking about some of his responsibilities and how they changed over the years before he became their CEO, what are some of the responsibilities that you would have at Carolinas Hospital System?
Well, there's a number of responsibilities. First and foremost is ensuring we're providing the best patient care possible. And that means making sure that our employees, that our physicians have the technology that's available to them that they need to take care of patients. Making sure that we're ensuring that the quality we're providing is the best possible. And as an administrator, you balance that realizing that you have limited financial resources. So you're looking constantly at how we can provide the best financial resources to our physicians, to our staff, for our patients in terms of technology and equipment, make sure that our outcomes are good, looking at how we're doing in terms of surgical technique, looking at length of stay issues within the hospital, and balancing that with the social obligation that all hospitals have, and that is to take care of the community, to make sure we're meeting the needs of the community, such as what we're talking about today, the heart ball, and some of the activities that we have to ensure that we're not only taking care of patients when they're ill, but also what we can do from a preventative standpoint.
Absolutely. And you all were so instrumental in helping promote the Heart Walk. We did a tape an entire week focused on the PD area Heart Walk, which they raised more than $250,000. And obviously the strength of Carolinas Hospital System and all the communities here in the PD really make something like that happen.
Yeah, and it's important because that raises funds for research, for looking at what we can do to improve technology, to improve prevention of heart disease, And those are the types of things that the hospitals and businesses need to be involved with as well.
Mm-hmm. And speaking of Carolina, the hospital itself, when did you all open its present facility?
We've been there for over 4 years now. It opened November of '98. And so in a little over 4 years, we've been in our new facility. And if you've not seen it, it's just a tremendous facility, and we're very proud of the hospital.
I hadn't been there prior to the taping back in November or in October, and it was amazing to see that facility. I hadn't seen anything like it.
They did a tremendous job in constructing that.
Truly. What are some of Carolina Hospital System's priorities in helping to really service the community? I know you talked about your responsibilities as CEO to make sure the hospital does much of what you were talking about. But are there particular instances or particular efforts that the hospital Rit Hole would do to service a community?
Well, there's certain areas that we've identified, and the health department has identified too, that South Carolina in particular has a higher incidence of problems. Heart disease is one.
Mm-hmm.
That's related in some respect due to dietary habits, due to lifestyle. And so one of the things that we can be doing better is to help educate the population on a healthy lifestyle. Cancer is another area that we see a very high incidence in the state of South Carolina. So we are looking at some of those areas where, as a state, we're not performing as well as we should from a health standpoint, and trying to work with the community from a preventative standpoint so that we can improve the overall health of the community.
Absolutely, and surely Carolina's hospital system has seen that. As the presenting sponsor for this year's Heart Ball, you all are on the forefront of helping lead the fight against heart disease and stroke here in the PD. And because of that, can we talk as to why you think, in your short tenure here, why you think it's important, heading up hospitals in the past as well as now, why you think it's important for the business community to get out to support the American Heart Association?
If for no other reason, and there are many reasons, but the cost just to businesses for their employees that have heart disease is tremendous. And there's a lot that can be done, particularly with heart disease and stroke, that is preventable. So by having the businesses actively involved in supporting the Heart Association, we can raise dollars that are instrumental for research in looking at preventative techniques, but then if there is a problem with heart disease, funding for resources for new technology so that the person who is afflicted with this can be back at work as soon as possible. So it's even in the business's best interest to support efforts of this type because it's good for their business.
It is, and those funds that are being raised here in the PD area or on the Strand or throughout the state are being kept for the most part in the state. Research facilities in Charleston and Columbia and in the upstate are really helping some of the disease recognition that we have on a daily basis.
Right, and there's probably no other area in medicine where we're seeing more advances on a regular basis than in the area of cardiology. There's just tremendous advancements that have been seen in the last decade in terms of just what's available to patients. Today, if somebody comes in and has heart disease, it's not unusual for them to have heart surgery and be home in 5, 6, sometimes 7 days. And just 10 years ago, it would be just a much more extended recovery. So the technology has changed tremendously, and that's because of the funds that have been raised to allow for research and development.
Mm-hmm. Have you worked with the Heart Association and other hospitals which you've served?
Yes, I've been very fortunate in many of the facilities I've been affiliated with. I've been working, I've had an opportunity, the hospital has, to work closely with the Heart Association, the Heart Walk, the Heart Ball, Gaylor events. Mm-hmm. Again, all very important efforts to help the Heart Association raise funds.
Jim, what kind of services does Carolina's hospital, cardiac services, does Carolina Hospital System provide here in the community?
The full scope of services, beginning with prevention. We do work with companies to try to do health fairs, screenings, cholesterol screenings. If somebody does have heart disease, we have services such as cardiac catheterization, stress testing to determine if, in fact, the disease is prevalent. If surgery is needed, we have a surgical program. And then post-surgery, we have a very a comprehensive cardiac rehabilitation program. We have a number of folks that after they have their MI or they have surgery, participate in that program and develop a healthy lifestyle and a regular exercise program.
That's fantastic. And that obviously ties into the next question. If Carolina's hospital system is providing prevention programs or other programs to help target the high disease of cardiovascular disease in the PD area.
Right, and that's very important because of the fact that we do have a very high incidence within the PD area of heart disease, stroke, and cancer, and those are the things that the hospitals need to be involved with to try to improve, again, the health of the community.
Jim, what do you think's impressed you the most about your move to Florence and your involvement now in heading up Carolina's hospital system?
I've been very impressed with, one, how friendly the community is, the professionalism of the medical staff and the associates that are working at the Carolinas hospital system. This truly is just a tremendous asset for the community. I'm very impressed to be affiliated with it.
Absolutely. As we think about, oftentimes viewers are so interested in when they think about, as you talked about, that not necessarily a tenure track to becoming the chief executive officer of a hospital or a medical center, or becoming the chief executive officer of any company. When they think about that, obviously there's questions always that come about as to what they did in the youth to help prepare them for something like that. And I try to think about, maybe you could talk real quick about like a first childhood job. Do you remember something early on in life that you got into?
Well, I guess like most, I started working very early. I wanted to be independent, so having a paper route as a young child, caddying to raise money, and that was something that I think my family instilled, is to be independent in order to provide for yourself. And I think also trying to take a leadership role in activities, and I think that's, some people are comfortable in that, and that's something that my family helped push me in that direction.
That's great. It starts at an early age.
It does.
Jim O'Laughlin, CEO of Carolina's Hospital System, the presenting sponsor for the 2003 Florence Heart Ball. Jim, thanks so much for being with us this morning.
Appreciate it. Thank you very much.
Stay tuned to more Carolina People coming up next. We want to thank all the sponsors and volunteers for making the 2003 Florence Heart Ball and today's Carolina People such a great success. If you haven't yet bought tickets, contact the American Heart Association at 843-665-0985.